Assalamu alaikum and welcome back to the Medic Hour. I'm Rabina Mir, your host for today, and we're looking at a health condition called diabetes, and in the hot seat today is Dr. Liz. Welcome back, Liz.
Hi.
We've been talking a lot about diabetes in relation to lifestyle, what it is, as well as the kind of things we need to think about and the responsibility that comes with being a diabetic. But one of the things we haven't talked about yet is actually why do we have to be so worried about taking care of ourselves? What can happen? What can complicate things for us if we're diabetic?
Diabetes can have serious complications, and I think you're absolutely right to make us think about those. So, every year somebody with diabetes will be invited to go to their doctor's surgery for a number of tests.
Oh, that annual review they talk about.
Absolutely right. So let's think about what the tests are and why they're there. So first of all, there'll be a blood test, and the blood test will be to measure how well controlled the diabetes is. It will be to measure how much cholesterol is in the blood, and it will be usually to check that the liver and kidneys are working okay.
Oh, okay. So the liver and kidneys are part of that care as well?
Yeah, very definitely to think about kidneys.
Okay,
because
why?
diabetes can affect people's kidneys.
Right.
So one of the tests that very often, and in fact you should have every year, is you have to take a specimen of urine, and the best urine is first thing in the morning, and we can do a special test on that to make sure that the kidneys are working properly.
So that's before breakfast?
Well, it doesn't have to be before breakfast, probably better before breakfast, but it's first thing in the morning, not at 3 o'clock in the afternoon.
And what's the difference then when you take that urine
It's
sample?
a more accurate measurement of how much protein is in the urine. Let me just explain something, Rabina. Kidneys are like a sieve. Now, I do baking, perhaps you do baking.
I do.
And we use a sieve so that all the bumpy bits and the lumps don't come through. And kidneys are like a sieve. They sift out the good bits and get rid of the rubbish.
Okay.
So, if our kidneys are working properly, we will not lose certain things out in our urine. But if our sieves are damaged, then certain things, certain proteins, will leak out into our urine.
Oh, okay.
So, we can do a test to make sure our kidneys are working properly.
So what does the protein actually mean then, if it's in the urine?
We need protein for all sorts of different functions, so we don't want to be losing a lot of protein.
I get you.
Whereas if our kidneys are damaged, we will lose that protein.
Okay.
So we're measuring the urine test, and one of the blood tests will tell us how well the kidneys are functioning and how much, if any, protein is being lost.
Okay.
So we're going to check the urine. Another thing is you'll have your blood pressure checked when you go for your annual checkup. Now, what a lot of people don't understand is that if you have diabetes, you are more at risk of having a heart attack or a stroke.
Okay.
And those can be seriously devastating conditions.
Yeah.
So very important to keep people healthy. And if your diabetes is not well controlled, you are more at risk of having a heart attack or a stroke. That's where blood pressure comes in, because if your blood pressure is high, if you think that the heart's like a pump, pumping the blood through your body, if the pressure's high, that pump has to work so much harder, so it's going to become tired, it's going to wear out quicker.
Is that like when you've got a garden hose and you've got somebody stood on it and it's not letting the water through properly and the pressure's building up?
Yes, exactly.
Okay.
So what we want is a healthy heart. So to have a healthy heart, we want a blood pressure which is the right level. And if the blood pressure's too high, there are lots of different tablets and medicines we can take to bring the blood pressure down.
Okay.
The other thing I mentioned in the blood test is measuring cholesterol or fat, because it's cholesterol which causes the actual blockage within the pipe taking the blood.
Okay.
So we want the right level of cholesterol. And again, we've got tablets, very good tablets, called statins, which can lower the level of cholesterol and keep it at the right sort of balance.
There's a lot of controversy about statins, and there's a lot of things going on in the community where we're all really worried about the side effects of statins. How can you reassure us about why they're good for us?
I'm going to be totally honest and say all tablets have side effects. Some people can't even take paracetamols, can they? It doesn't suit them. And so any drug can have side effects which for some people make them not possible to actually take. And so some people don't always take statins and feel 100%. And one of the commonest causes with statin tablets is it can cause aching in muscles.
Yes, I've heard
Tends
that.
to be the big muscles, so tends to be your legs or your shoulders.
Okay.
And possibly 8 out of 10 people are fine, but there may well be some people who can't. But also, Rabina, we do have several different statin tablets.
I was just going to say
so
they're
if you
only
can't
one
manage
type,
a certain tablet, very often, myself as a doctor, if I have a patient who tells me that, I'll try a different tablet and see if they can manage that. So I'm not for 1 minute pretending that tablets can't have side effects, but I think as with all tablets and medication, it's a matter of weighing up the benefits and the risks.
So what if you're a diabetic who doesn't have high blood pressure, you don't have high cholesterol, do you still need statins?
The answer to that is very often statins are advisable even if your cholesterol level isn't really high, because it prevents the fat that can build up from floating away and blocking any of the very, very tiny arteries. So it's not just a matter of how high is your cholesterol level, it's also a matter of thinking there's this additional benefit from taking a statin.
So are we talking about risk factors in terms of why that becomes necessary?
We're talking about risk factors, yeah.
Okay.
So for instance, talking about risk factors, are you a smoker?
Right.
That is really, well, nobody should be smoking. I'm going to be very black and white about that. I'll probably not please everybody saying that, but smoking really a big risk factor for people who have diabetes.
Okay.
Increases the risk of heart attacks, increases the risk of strokes. So people
And
with
other things, of
diabetes
course,
and other things, not talking about cancer of the lungs and all sorts, aren't we?
Absolutely.
But just concentrating on the diabetes point of view, smoking is really, really something people must consider, and it's incredibly difficult to stop smoking, which is why as healthcare professionals we really want to help people to stop. So if people want to stop or find out about stopping, it's worth going to see your GP or the practice nurse. The practice nurses are fantastic. A lot of them have had special training to help people to stop smoking, and that can be using tablets, it can be using patches. There are lots of ways of helping. Just the psychological support of stopping smoking, it makes such a difference if you've got somebody there who's helping you.
I think that psychological support also fits in with how we have to look at food and because food is one of the vices within many of our communities in terms of it's how we socialise, it's how we enjoy time with one another. We don't take a bowl of fruit in when we're having a party, we take cake, don't we?
But hang on, why shouldn't we take a bowl of fruit?
Well, I think
there are some beautiful
culture,
fruits. I mean, I absolutely adore strawberries and raspberries and blueberries, and they're a bit of a treat because they're not that cheap. So actually, why shouldn't we consider taking
Well, I guess
the
because
fruit?
the birthday cake isn't made out of fruit, is it?
Well, the thing is, it's getting this balance, isn't it? It's knowing that we can eat anything we want to, but in the right amounts. And also, we can have chocolate, but we shouldn't be eating it every single day or twice a day.
It is about that moderation
It's that
you were talking
balance.
about, wasn't it? Yeah.
And again, it's here we go, the responsibilities that looking after yourself means you do have to weigh up what you should and what you shouldn't be eating or how often.
Sure.
So, back to this checkup.
Yeah.
We're checking your blood, we're checking your blood pressure. We'll put you on the scales as well, because that's amazing. We can see how things are improving or the weight's going up. And anybody with diabetes should have an annual eye checkup.
Yeah, they call that, what is it, retinal screening.
The back of the eye is called the retina.
Yeah.
And what happens is the blood vessels in the back of the eye are tiny, tiny and incredibly, incredibly delicate. So just imagine you have, let me call it sticky blood flowing through those delicate blood vessels, because there's lots of sugar in it. You can imagine it can damage those very, very delicate blood vessels. So when you go for retinal screening, what will happen is they will actually take a photograph of the back of the eye.
Yes.
And then they can look at the photograph in great detail, and they can see if there are any signs that diabetes is causing a problem. And here we go again. If your control is not very good, you're more at risk of having problems. But
they sound like they could be serious problems.
Oh, well, losing your sight is a serious problem.
Okay, so it's as serious as that.
Yeah. But the good news is we have laser treatment which can be incredibly effective if we can find that people have those problems.
Okay.
That's why we're saying every year go and have your retina checked, because we can compare this year's photographs with 2016's photographs.
Okay.
We can see if things are changing. We can see if something's developed, which is not a good sign since last time, and then we can very quickly, beyond that, and if necessary, organise some laser treatment, which I have to tell you doesn't hurt a bit.
Okay.
I've had laser treatment, so I know it doesn't hurt at all.
Well,
so very, very positive there, but you need to go and have the check done.
Okay.
Going back to the check in the GP surgery, what we'll also find is that the person's feet will be examined.
Now somebody asked me from the community, I think it was Aksa again, who said, why do you have to cut your nails in a certain way?
Well, before I quite answer that question, I just want to explain why we examine feet. There are other complications with diabetes that affect the feet. There are two main complications. One of them affects the circulation.
Okay.
Now, we need a good circulation to all parts of our body to keep that part of our body healthy. And if you have any problems with your circulation, it can affect how much blood is getting into your feet, into your toes, and therefore you can have problems with ulcers, for instance.
Okay.
Now, the other thing is if you have an ulcer or a crack in the skin, germs can get in there and you can get an infection. And if you have diabetes, those infections can be really very serious.
Isn't it right also that with diabetics, if you bleed, you take longer to heal or something, or bruises? Is that correct, or am I misunderstanding that?
No. Your blood will clot just as quickly if you have diabetes or not diabetes.
Okay.
So the bruising, I think that's...
So I've misunderstood that.
I think that I would not agree with that.
All right.
But you are sort of right when you say that if you have diabetes and you have an ulcer or an infection, it can take a lot longer to heal. Okay. And that's because with our feet, for instance, if we don't have a really good supply of blood, we need the blood which contains the energy for the wound to heal, and also the oxygen to keep the part of our body healthy. So we need a good circulation. The other risk with our feet is that we can't feel things properly. So our nerves are actually affected.
You talked about somebody earlier off the show before we came in. You mentioned somebody that you knew that had stood on a nail and not even realised it.
Because the nerves don't always work as well when we have diabetes, you don't feel things as much. So, for instance, I saw somebody not very long ago who'd actually stood on a drawing pin. Somebody had dropped a drawing pin on the floor and it had gone through his shoe and was literally sticking up into his foot, and he couldn't feel it. He didn't know it was there. And because he wasn't looking at the bottom of his foot, he didn't know that what was developing was not just the fact the skin had been pierced, but germs had got in, and he was developing quite a nasty infection. So that's why we check people's feet. Are they healthy because they've got the right supply of blood? And you know, can you feel a pulse in your wrist?
I can.
Just as you've got a pulse in your wrist, you have a pulse behind your ankle and on the top of your foot. So it's quite easy to check if the blood supply is getting through. And there's also a very easy check with the special instrument to see if we can feel. So checking the feet, really, really important. So Aksa's question about should I cutting toenails, if you cut your toenails, cut them properly.
So what's properly then? Yeah.
Well, properly is we don't want somebody who can't see because their eyesight's not very good shoving a pair of scissors in a sort of random fashion. Far better to use a file and file them down, or far better if you're struggling because you can't get down, ask somebody else to cut them for you.
Most people use nail clippers nowadays.
Yeah, whatever, but make sure you're doing it properly so you're not going to cut the skin by accident, because that's how the germs are going to get in.
So it's not about the angle of the nail being cut, or is that part of it
Well,
too?
the trouble is some people don't cut their toenails properly. They tend to go down and start poking away. So without realising it, they're breaking the skin. And if they're one of the people whose nerves have been affected and they can't feel it, then they won't even know that there's a break in the skin and that germs could perhaps creep in.
And is foot hygiene part of that generally anyway?
Yeah.
I mean, I think
because
most people do, you know, they shower and they bath and do all the things you kind of hope
But
they
even
do.
so, a lot of people will have very dry skin on their feet.
Yes.
And we all know dry skin can crack easily. So you get very dry skin, it cracks. Your feet are a bit warm and wet, they're a bit sweaty, it's a hot day, you've been wearing your socks and your trainers all day. So again, germs can get in. So putting cream on your feet, if they're very flaky and dry, will actually stop some of those cracks coming, which can go on to lead to other problems. So yeah,
that's
foot
really helpful to
hygiene,
know.
really important.
Really important. So if you're doing your wudu and you're praying regularly, hopefully you'll be on top of that anyway. Okay. What else about the complications?
We've talked about heart attacks and strokes. We've talked about cholesterol and blood pressure. We've talked about having your eyes screened every day. We've talked about having your feet. We've talked about kidneys. Oh my goodness, this is turning into quite a list.
There isn't really much part of the body left to...
But we've gone through quite a lot of it. Well, let's just think about ladies who are of childbearing age.
Okay.
If you have diabetes and you are a lady who's considering becoming pregnant, very important to discuss that with your healthcare professional, with your practice nurse, with your doctor. Because first of all, it's more difficult to conceive if you are very overweight.
Yes.
And secondly, if your diabetes is not well controlled, there is a risk both to the baby and to the mum. So very important to get the diabetes really well controlled even before you get yourself pregnant.
So when you say there's a risk to the baby, is this to do with the baby absorbing the sugar and being bigger than it might be, and then perhaps having to have a caesarean instead of a natural birth?
But also increase in deformities such as spina bifida and things like that.
Oh, okay.
So very important.
I didn't know that.
Yeah. Increasing number of stillbirths, unfortunately.
Okay.
So really very important.
Yeah, absolutely.
And the thing is, because we're finding younger people are becoming diabetic, thinking about the type 2 patients with type 2 at younger ages, these are ladies who are still wanting to have children, but have really good control of your diabetes before you go on to get pregnant. So it might mean you're thinking 6 months in advance. And also something I must mention, and we haven't talked about it yet, the treatment and the tablets for diabetes.
Yes.
There's certain tablets that if you are pregnant, we wouldn't recommend for diabetes.
Okay.
Let's talk about tablets and let's talk about treatment.
Okay.
We've talked a lot about having the right diet, having the right lifestyle.
Because that's all about trying to prevent it in the first place, as well as controlling it when you've got it.
And it never goes away, this idea of thinking about food and thinking about exercise. But there may come a time when, even when we're trying really hard with our diet, with our exercise, the blood tests which are done show us that we're not really controlling our diabetes as well as we should. So then we could start thinking about certain tablets. Now, there are quite a few different tablets that we can take, and the doctor who you see will be the best person to decide which is the best one for you.
So how do they make that assessment as to which tablets suit? Is it because of what they do?
For instance, one of the best tablets to start with when you have diabetes is a tablet called metformin.
Yes, I've heard of that.
And it's usually taken twice a day, although it can be taken just once, and it can be taken in different dosages. But it's a particularly useful tablet because it doesn't put weight on, and we've emphasised so much how important not putting weight on is. And also, a lot of research has gone on to into all this study of which tablets, and it does have a protective effect on your heart. And do you remember I said people with diabetes are at an increased risk of a heart attack or stroke, and if your diabetes isn't well controlled, your risks are higher. So metformin, really useful tablet.
They're quite big, those tablets.
They are. You can get it in liquid form, but that's incredibly expensive. So we do we do prefer our patients
We
take
just
tablets.
need the manufacturers to make slimmer tablets.
Don't ask me why they're not. I can't answer that one. Some people will find they'll start on one tablet, it's not enough. And do you remember we talked about side effects?
We did.
Every tablet can have a side effect. So metformin for some people can upset their tummies. They can feel a bit bloated or a bit windy. So might not suit everybody. But some people might find, despite taking the full amount of metformin, it's not good enough. So we may need to add other tablets. For instance, gliclazide, glimepiride. Now, I don't expect you to have heard of these, but there may well be a lot of people who are listening to us now who are on these tablets. And these are very good tablets. They will lower the level of glucose. However, that particular group of tablets can tend to put weight on. So here's me giving you a big lecture about losing weight, but unfortunately, that's one of the side effects. We've got other tablets. We've got pioglitazone. That's particularly useful for, remember we talked about the fat and insulin resistance. That reduces the resistance of the fat against the insulin.
So it's not getting rid of the fat, it's just reducing the resistance of it.
We've got other tablets which work by encouraging our kidneys to pass out a bit more sugar. So we're effectively weeing out some glucose, which will bring down our blood glucose levels, and because we're weeing out glucose, can help us to lose weight.
Okay.
We've got other treatments for diabetes, such as insulin. Insulin isn't the only injection treatment.
Okay.
We do have another injection treatment before we often go on to insulin, but insulin is the treatment everybody's heard of. And insulin is a fantastic treatment for diabetes because all we've been talking about is, do you remember, this balance of insulin and glucose?
But I think one of the reasons that it encourages to not become insulin dependent, of course, is the fact that you've got to inject it into yourself.
Yeah, but
very unpleasant.
Well, no, I'm going to disagree with you again, Rabina. People are very frightened of insulin injections.
Well, I know people that don't like to have injections.
Well, I think the thing is, people think the syringe is this big and the needle's that big, and it's so far from the truth.
Yeah.
The injection devices for insulin are fantastic. It really looks like a pen. We call them insulin pens.
Yes, you do. Yeah.
The needles are tiny. They are so small that you know how some people will prick their fingers to measure the amount of glucose at any particular time? The injection needles cause less discomfort than when you prick your finger.
Okay, well that's interesting.
And the trouble is, everybody jumps to the assumption that insulin is dreadful and I've failed and oh my goodness. But insulin is a fantastic treatment. So we should be positive about using insulin if and when somebody needs it. And we're not going to suggest somebody takes insulin until we've tried various other treatments. And most important, that our person with diabetes understands why we are suggesting and encouraging them to think about insulin, because it is, well, for somebody who doesn't have diabetes, it's the natural way of controlling the blood glucose. It's getting that balance right.
Liz, I could talk to you forever. Unfortunately, we're almost coming to the end of the programme, and I need to make sure that we get in our top tips for our community out there so that everybody can go away thinking about the reasons that they need to take some more ownership of their health. So what would you say would be the top tips you'd give today?
Well, I think I would give something that sounds so simple but needs a bit of thinking about. I'm going to say, eat less, walk more. So in other words, think about your diet, think about your physical activity. Eat less and walk more.
Thank you very much. It's been lovely to have you here, Dr. Liz.
Thank you.
And I look forward to seeing you again. So there you have it, everybody. We've come to the end of the show. I hope you found it informative. We certainly are aiming to help everybody out there to feel that they can ask questions about topics that we're going to cover. The next topic that we're going to be looking at is minor illnesses. So I look forward to seeing you all then. Assalamu alaikum wa rahmatullah and goodbye for now.